Hello, I'm State Senator Nina Turner from Cleveland. Welcome to Ohio in Focus.
Thanks for joining us for Ohio in Focus, the program that brings state government to you. I'm your host, Mike Rao. Today we are joined by Senator Nina Turner, the minority whip in the Ohio Senate. She's here for a mid-year legislative update. Senator, welcome back to the show.
Thank you, Michael.
There's lots of things to talk about. You've been very busy this year.
Just a little bit.
Just a little. Let's start off with the Cleveland School Plan, which you were a co-sponsor for and pushed very hard for. Now that it's actually passed, pleased, I assume you're happy with the way things turned out?
Yeah, the real work begins now, but it certainly was a bipartisan effort from beginning to end, not one of these we got one or two people from the other side. I mean, we really did this in a bipartisan way in both chambers, and I am very pleased with the results, and definitely thank the mayor for standing up, for having the courage to stand up for Cleveland's children. So we finished the legislative portion. Now comes the other portion of this, which is the levy. And
that is basically a two-part process. That was passing at the first,
yes,
and now we have the levy. How vital is it for the citizens of Cleveland to now kind of carry this across the finish line?
It's very, very important. We have not had an operating levy pass in our city since 1996. That is a very long time. We are bleeding students, we're bleeding population. And one of the things that the residents are going to have to ask themselves is whether or not they want to live in a city or a cemetery. If we want to live in a city, then we need vibrancy, and that vibrancy starts with the Cleveland School District. So it is very, very important. Part of our slogan is the right time, right plan, right time, and this is the time. We have to deliver for our students, and we got to pay it forward just like someone else paid it forward for our generation to attend a school. So it's going to be hard, but it's going to be exciting, and I believe that the voters will come out and say we are going to support our children. It's only going to be a 4-year levy, which the voters will get an opportunity to come back and decide, did we do all that was promised? And if we did not, then they don't have to re-up, so to speak, on that levy. So it's a lot of pressure.
There's a lot of different aspects to the Cleveland plan, but as you look at the plan overall, what do you think are the key parts of it and the key parts that the public needs to know about?
Being able to go into low-performing schools and look at them uniquely and not have a one-size-fits-all, and giving the superintendent that flexibility along with the teachers and also the administrators in that building, pushing down more leadership opportunities to the local principals instead of it being in the district office, more expansion of pre-K. We know we have to go after students a lot sooner, a lot earlier, and there are studies out there that show that if a child is in an excellent pre-K program, you increase the likelihood that they will graduate. And different pay scales for teachers that take on harder assignments, teachers that may have special skills. The opportunity for good teachers to make more money is also attractive too. And the district is very committed to attracting even more high quality teachers into the school district. So there are a plethora of things that the voters of the city of Cleveland should be pleased. The real fight here is not only passing the levy, but it's going to be the execution phase of that. And so we all can play a role in that.
Another issue I want to talk to you about is something I know that's near and dear to your heart, having served on city council in Cleveland, and that's the idea of local government and the funding of local government, which continues to be an issue going back to the budget fight from a year ago. You're still out there saying that we need more funding for our local governments.
We do, and now that the state has this surplus, I believe that the governor and the majority party should join Democrats in making sure that that money goes back to local governments. There are 2 cities in my district right now, and there are other cities across the state, but for example, in Shaker and also Richmond Heights in my district, they're going to have measures on the ballot asking the local taxpayers to increase taxes. That is all because of the pass-the-buck budgeting that went on in the last biennium budget, about $460 million cut from local governments. That fund is about service. Who's going to be, when a resident calls 911, they want to know that help is on the way. Well, in some communities, it might be and it might not. But the state certainly has overburdened local governments and also school districts. And I believe we have an obligation to give local governments back some of that money, restore that money that was cut.
The overall cut for the biennium is about half of the local government fund. Some the first year, and really, I think even more in the
Yes.
second year.
Yes.
Do you get the sense from the local governments in your district that they're prepared for this second wave? I mean, they may have survived the first
Right.
wave of cuts, but now the second wave?
No, I don't think so. And they're going to see that not only the second wave of cuts greater, but you couple that with the repeal of the estate tax. And this is a tsunami for local governments. So no, they're not ready. And a lot of local governments already collaborate. I mean, you can't collaborate your way out of the cuts that that this last state budget put on local governments. So because we have some money here on the state level, we need to recommit that money back to local government so that they can provide the services. They are the front line of defense when it comes to servicing our collective constituencies in the state. They didn't ask for this and they don't deserve it, and they need some help from the state, and we ought to give them back some of their money. A lot of that money comes from, it's generated locally. So the taxpayers deserve to have some of that money go back to them so that government can provide their services.
Okay. I said we're going to touch on a lot of issues.
Yes.
The next one I want to talk about is the Affordable Care Act, which recently the Supreme Court said is constitutional and survived a challenge, and it's now being phased in. As you go through your district, what are constituents saying to you, and what are you saying to them in regards to this?
That most of my constituents believe it is a good thing. I mean, there's still some constituents who are unsure about all the pieces and the parts, but things like being able to keep their children on their health care till their child is 26 or a young adult at that point. But as they're trying to navigate life, they can be on till they're 26 years old. No lifetime caps. Can't discriminate against folks who have pre-existing conditions, even children. I mean, those are some of the highlights of the Affordable Care Act that every middle class and working class person can really relate to, and that people are very excited about. So people are very supportive in my district of the ACA, and what we have to do is continue to educate them about it. There are a lot of phase-in parts to the Affordable Care Act going on right now, one of which is happening today.
Yeah, the day that we're here taping this is
Yes.
a day that another aspect's being phased in that'll benefit women,
Yes.
and that's that you can't, when you get insurance, sign up for insurance or renew your insurance, that they have to pay for certain preventative care.
Absolutely.
And considering, your stands on various women's health issues,
Yes.
I imagine you consider that to be a very important milestone.
Oh, it is, Michael. It is a great day for women in this country, that women cannot be discriminated against based on their gender. I mean, women find themselves paying a higher cost for health care costs. Absolutely insane. In some cases, some insurance companies label having a C-section or domestic violence as a pre-existing condition, if you can believe that, being able to get access to contraception without having to pay a copay. All of these things are great for women, but it's also great for their families, because when the woman is healthy, it helps the family as well. Not having to go through your primary care physician to get access to your OBGYN. Those things are important to women. So this is a great day, and as their health insurance is phased in, they will begin to see some of the great things happening in the Affordable Care Act for women. So it is a great day for women.
Another aspect of the Affordable Care Act is how the states are going to interact with
Yes.
this. And one aspect of that is the state-run insurance exchanges. At the time we're talking right now, it's still undetermined if whether Ohio will create its own exchange or wait for the federal government to do one for Ohio.
Right.
What do you think should be done?
I believe that Ohio should create its own exchange. We know best what our citizens in the state needs, and for us to abdicate our responsibility to do that, the federal government for the first 3 years will pay, 100% of the folks that go into that exchange, and then 90% thereafter. It is ridiculous, in my opinion, that we would not step in and do what is right for the citizens in this state that need that. So I'm in support. My colleague in the Senate, Senator Skindo introduced a bill months and months ago to get the state to start to create the exchange. Senate Bill 277, I believe, is the number. So we should step up as a state. It's funny how I hear all this rhetoric about states' rights, and when given the opportunity by the federal government to create an exchange that is very much in line with the needs of the residents of Ohio, that we have some folks in the administration that have decided that they're going to just hand it over to the feds is wrong.
And an exchange is basically a marketplace.
Yes.
For not only individuals,
right.
but also small
businesses drives down the cost. It's a way for folks to have access to high quality health care at a reasonable price. And that is really what the Affordable Care Act is really all about. And we got about 30 million people out there who do not have health insurance. We pay one way or the other. We pay, those of us who are privileged enough to have insurance, we pay. So this is a more preventative way to make sure that we capture folks who do not have health insurance. And we should stand up in Ohio and do the right thing.
All right. Thank you, Senator Turner, for coming by to talk about these issues. Covered a lot of ground.
We did.
And we'll have to have you back.
You're good.
All right. Thank you, Senator. Well, you can follow Senator Turner and the rest of the Ohio Senate Democratic Caucus on Facebook and at ohiosenatedems.blogspot.com. Thanks for watching Ohio in Focus.